One of the most frequent reasons for a pediatric emergency room visit is abdominal pain in a child. One of the things that's very helpful is to determine the onset of the pain. Does the pain wax and wane? Is it constant? Is it increasing in severity? Is the child able to localize the pain to one particular area of the abdominal wall? Pain that's constant, that seems like it's increasing in severity over a fairly rapid time interval of several hours. Has the child had any other associated symptoms, nausea and vomiting, diarrhea? If you really see him limiting his activity, bending over double, stopping what he's doing, then that's a real concern. As the abdominal pain progresses, if it is a surgical etiology, you may notice a marked decrease in his activity. He may actually refuse to walk. He may preferentially just want to curl up on the couch in a ball. You may see him when he's walking, kind of favoring one side, bending over, holding his right side. All those things are helpful. Other things are there any associated symptoms? Has he had any fever? With appendicitis, it's very typical early on to have a low-grade fever. Surgical problems, if the child's never had previous surgery, we typically see an entity called ileocolic intussusception in the 6-month to 18-month range. The small intestine actually telescopes into the large intestine. Usually it's from just the lymph nodes in the GI tract getting enlarged, sometimes following a viral illness, and that can cause a complete bowel obstruction. And those children typically present with intermittent episodic crampy abdominal pain that seems to increase in intensity over a relatively short duration of time. Appendicitis is actually one of the most common. There are over 90,000 ER visits a year related to appendicitis. So that's probably the most common surgical problem in children in the peak ages, childhood and early adolescence. I think that if the pain is constant, increasing in severity over a short time, of course, low threshold for getting in to see a pediatrician or being evaluated in the pediatric emergency room.